Previously, I have discussed about introduction of blood, blood pH, total volume of blood, functions of blood, and composition of blood. Then diseases of erythrocytes. Now in this session, I am going to discuss one by one diseases, hematological disease. So first of all, I want to discuss about anemia. Here I am going to discuss definition of anemia, risk factors for anemia, pathophysiology, and types of anemia. These risk factors will be common for all hematological diseases. Pathophysiology also common. And types of anemia, if you know the types of anemia, you can discuss or you can write yourself. So it will be easy. Now you have to know about anemia as because all are anemia. You see, iron deficiency anemia, megaloblastic anemia, sickle cell anemia, hemolytic anemia, thalassemia. These all are anemia. So you have, first of all, you have to know about anemia. What is this? So you know anemia when this term is used. So anemia is defined as decrease in the total amount of red blood cell, or you can say RBC, or hemoglobin concentration in the blood volume. Hemoglobin concentration is decreased in blood volume, or you can say RBC, or RBC is decreased. Total amount of RBC is decreased. Then normal range, or you can say below normal. When this anemia term is used, when hemoglobin level or concentration is decreased in RBC, or total amount of RBC is decreased than normal level, this condition is known as anemia, anemic condition. Now we have to know the normal volume of normal level of hemoglobin. You have to know this, it is important for MCQs. 13 to 14 gram per deciliter in case of male, or you can say 14 to 15 gram per deciliter, and 12 to 13 gram per deciliter in case of females. This is the normal level of hemoglobin. So what will happen if hemoglobin level is decreased or RBC level is decreased in your body? So you know hemoglobin is hemoglobin containing iron, heme, and globin, protein. So this heme iron carries oxygen, or you can say hemoglobin is oxygen carrying element. When this hemoglobin content is decreased, so your body will get less amounts of blood. So you have idea regarding if your body have less amount of blood, then you will feel tired. So lack of oxygen in your blood, it can damage some vital tissues like heart, brain, and other organs of the body. This is about anemia. In anemia, you have to know the definition. Normal level of hemoglobin, and what will happen if oxygen level is decreased. So next you have to know about types of anemia. Types of anemia. It is important, you have to remember this. First one is iron deficiency anemia. Second thing is megaloblastic anemia. Here you can say vitamin B12 deficiency anemia or vitamin B9 deficiency anemia, or it is also known as folic acid, or pernicious anemia. This pernicious anemia. Have folic acid deficiency anemia, vitamin B12 deficiency anemia, and pernicious anemia. Next, aplastic anemia. Next, hemolytic anemia. Hemolytic anemia. In hemolytic anemia, there is thalassemia, sickle cell anemia, and hereditary acquired anemia. Hereditary acquired anemia. Next, hemophilia. This is the common classification of blood anemia. You have to remember this. This is very, very important. It will be common. Next, you have to know the risk factors for anemia. Risk factors. Now, what are the risk factors for anemia? You can say diet. First of all, diet. If you take diets which contain low level of iron or vitamin, containing low iron or less quantity of iron, vitamins and minerals. Next, in case of injury, or you can say during surgery, blood loss is there, or you can say severe illness or serious illness such as kidney disease, diabetes, in case of cancer, rheumatoid arthritis, HIV, or you can say AIDS, IBD, inflammatory bowel disease, heart failure, and thyroid disease. These are the some serious illness. Due to for these diseases, anemia may cause. Another thing is there, malfunctions of liver and spleen. You know, blood is forming from spleen also, and liver, RBC is stored in liver. If liver and spleen is not working properly, there may be chances for anemia. In lastly, you can say long-term infection. So in next session I will discuss some symptoms, pathophysiology and all. Thank you.